Last Saturday, Fort Portal was awash with the news of the death of a local artist, Moses Kigambo Araali, who collapsed and finally passed on after struggling to get care from Fort Portal Regional Referral Hospital at Buhinga. According to relatives, Kigambo Araali did not get any care from the hospital administration and finally died in the hospital.
We don't have any representation. All the other districts, up to Bundibujo, up to Ndoroko, up to Kamwenge, Chegegwa, they have a representation managing the hospital. So this is a point which must be recorded and implemented. Fort Portal must have a representation on the board of that hospital.
Madam PS, 8 doctors have been granted study leave. At the same time, leaving the hospital understaffed. 2 others have disappeared, but drawing government salary.
One of those who claims to have suffered at the hands of health workers was State Minister for Primary Health Care and also Area MP Margaret Buhinga.
Me, I have been a victim of extortion 3 times. 3 times in that hospital. Record everything. When you are in the hospital and you are being extorted, please take a picture.
You better not fall sick on a weekend, because on a weekend the doctors will not be there. So we have a lot of issues going on. People have been operated on, had surgeries, and those surgeries, instead of resulting into them becoming better and their lives and their health being restored, their health worsened.
Following the public outcry over the matter, the Permanent Secretary at the Ministry of Health, Dr. Atwine, arrived to intervene in the matter. Dr. Atwine inspected the health facility and later convened a closed staff meeting on the matter.
We are not there just for purposes of titles. We are there to serve the people. And the people must get feedback, must give us feedback on how we serve them.
Following the meeting, it emerged that the hospital director, Dr. Adaku, had been indicted and a recommendation for all doctors involved in last Saturday's mishap to be transferred.
We have had opportunity to interact with our workers. We have had opportunity to interact with the public. We have had the issues, and some of them, they are giving us opportunity to go back and take action. But most importantly is also to assure them that government is not sleeping.
Later, Dr. Atwine joined a public dialogue at Boma Playground in Fort Portal City, where different leaders expressed concern at the situation in the hospital, including absenteeism, extortion, and neglect of duty by health workers at the facility. In response, Dr. Atwine apologized to the public and family of the late Moses Kigambo Araali for the problems at the facility, pledging to have them resolved.
I am standing here on behalf of my technical people, and we apologize. We apologize for the things that we have done wrong.
Yes, indeed.
We have done.
Dr. Atwine, who has been on a countrywide tour of facilities, says the ministry is determined to take stern action against the health workers at Fort Portal Regional Referral Hospital in Buhinga.